Well, it was kind of an evolving process, but here we started talking about this in our state back in early January. By the end of January, our emergency management teams were meeting about it, strategizing about it. And I brought in a team at the beginning of February as the chairman of the National Governors Association. We brought in Dr. Anthony Fauci and a number of top leaders from the federal government to advise all the governors, gave a presentation here when we had the winter meeting of the NGA in Washington. And they sort of gave some very frank talk. This was quite a while before a lot of people were focused on it. And I came back the day after that, and we ramped things up dramatically. I was, I think, one of the first governors in America to declare a state of emergency. I was the second person to close all the schools in the state, and we've I think now instituted 26 or 27 executive orders. Each one was taking more and more action. Things like shutting down all but essential businesses, and now stay-at-home directives, and things that nobody would have imagined that we would ever be thinking about taking, but we've had to do it because as we talk to the experts, the doctors, we have a coronavirus team here in Maryland, response team made up of the smartest epidemiologists from Johns Hopkins and from the University of Maryland Medical System and MedStar Health, all these guys that I've been listening to, these doctors and scientists that are telling us just staggering numbers about the crush on our hospital system and the inability to handle it, and the numbers that could be possible, the people we could lose in our state, the deaths, and the people that could be sick if we didn't take these actions. We just felt we had to do it. But it's been an evolving thing for months that we've been looking at this.
Final question. What worries you the most? What keeps you up at night?
Well, I've been keeping up a lot at night, and there are so many things that we're all worried about. But probably the scariest thing are the lack of resources in the hospitals, this surge that everyone talks about. If we don't flatten this curve and too many people get sick at the same time, that we don't have enough ventilators, we don't have enough personnel in our hospitals, and we don't have enough ICU beds and emergency rooms to handle that. That's really the scariest part of it. I mean, there are a lot of things that keep you up at night, but that's the thing that we really have to get a handle on, and that's what you're seeing in New York City right now, and trying to stop Maryland and the Washington region here from being like New York City. That's what keeps me awake at night.
Governor Larry Hogan, he's also the chair of the National Governors Association, joining us from the state capitol in Annapolis. Governor, we thank you for being with us.